Peter Nash collects old telephones. He's got a couple of really old doozies like this, and about a dozen rotary dial phones. Tinkering with old phones is a hobby that helps him wind down after a long day at work.
When I don't get sleep, I don't eat right, I'm grumpy, I'm not really safe when I'm driving, I can't work efficiently.
Peter first started having problems sleeping about 20 years ago.
It just got to the point where I couldn't function, couldn't do my work, and I went to the doctor. It was a pretty bad day, and I was essentially crying as I walked in. The doctor and says, I can't do it. I can't live this way.
He was diagnosed with restless leg syndrome, a neurological disorder which affects as many as 10% of the U.S. population.
I'd be lying there relaxed and doing fine, and then I'd start to feel it's like a rubber band coiling up in my knees, and they just had to release, and it came out as a twitch or a kick, and it was enough to completely wake me up.
Years later, Peter found out he had another sleep disorder, sleep apnea.
So it wasn't showing up as a snore so much as it was just long times with no breath and then gasp.
Jerry Wadsworth also suffers from sleep apnea. At 76, he has a pacemaker, and that, combined with a sleep disorder, puts him at greater risk for a dangerous heart rhythm disorder called atrial fibrillation. Before his diagnosis, Jerry had lots of restless nights.
I would dream that I was in a very claustrophobic area. Couldn't get my breath, or that I was almost being buried alive, and I would wake up, my heart would be racing, and that's what I would call a panic attack.
Before going to bed, he straps on a mask connected to a CPAP machine which helps him breathe.
There is never a night goes by that I don't use it. I carry it with me. When I travel, it's been on airplanes, cars, everywhere. It's right with me. It's more important to me than my luggage.
More than 1/4 of the U.S. population report not getting enough sleep, and 10% suffer from chronic insomnia.
We as a society are not getting enough sleep.
As a neurologist and sleep physician, Dr. Meredith Snapp sees lots of patients who have trouble sleeping.
You know, we've all heard adages, and I've told myself at different times in my life that we'll sleep when we're dead, or sleep is for the weak. But we don't recognize how important that is as a foundation for a healthy lifestyle, as important as exercise and healthy diet.
When you're getting good sleep, something important takes place in your brain. Cerebrospinal fluid, or CSF flow, increases to flush out toxins that accumulate in our brain during the day.
That's why a lot of times when we wake up without good quality sleep, we feel like the cobwebs haven't been cleared. We feel foggy.
Sleep deprivation can contribute to a number of chronic diseases, including hypertension, diabetes, depression, and obesity.
We also have a very strong circadian rhythm. The cues internally but also externally that tell us when it's time to go to sleep and when it's time to wake up. And if you have a well-trained circadian rhythm, you should naturally fall asleep at the right time and wake up at the right time.
But if you need an alarm clock to wake up in the morning, that could be a sign that something is wrong. Here are some ways to increase your chances of getting a good night's rest. Go to bed and get up at the same time each day. Limit exposure to artificial light like TVs and cell phone devices. Avoid large meals, caffeine, alcohol, and nicotine before bedtime. Swap out fluorescent bulbs and bedroom lamps with incandescent bulbs. If you're on a prescription sleep medication, make sure you take it on time each night. Peter Nash has an alarm on his phone to remind him.
If I'm going to be leaving and expect to be out of the house, I take medicine with me in my keychain pill bottle. So I've got my phone with the alarm, I've got my medicine, so even if I'm out traveling, out from the house, I can take the medicine.
If you do all these things and still have problems sleeping, ask your physician for a referral to a sleep lab.
When we see people in the sleep lab, we'll see small arousals that don't necessarily come to full consciousness, so you're not aware of how many times you're arousing out of deeper stages of sleep, and therefore just not getting a good quality of sleep.
A sleep study can pinpoint which disorder you have and help physicians come up with a plan for managing it.
If you're not waking up in the morning feeling rested, you need to get assistance from someone that can look at it from the outside and help you figure it out. It makes a difference in ways that you don't even know about until it might even be too late.
Since Peter knows about his sleep disorders and how to manage them, he's more alert during the day when he has to work or when he's fixing another old phone to add to his collection. For Carolina Impact, I'm Jeff Rivenbark reporting.